guys, and welcome to the Happy Artichoke. My name's Rachel, and today I want to talk to you about things you should know as a consumer of healthcare. I just recently had surgery on my thyroid. I'm post-op day 12 and feeling pretty good, and I've come up with a short list of things that I think every patient should know. Number 1. This might seem somewhat obvious, but take your time deciding what healthcare plan to choose when your employer offers one. If you're married or sharing a healthcare plan with someone else, take time to really look at the pros and cons of each plan. Some plans offer things like a health savings account or a flexible spending account. Those things are really important to take into consideration when choosing a plan. Also think about if you're willing to get new providers. So if you want to follow the current doctor that you have, that might be considered an out-of-network cost. So those are things to be aware of before you decide which plan that you take. For example, when my husband and I chose between my employer's plan and his, they actually looked very similar. However, my husband's plan would allow us to have a greater health savings account, and that was really important to us, so that's what we decided to go with. You can actually sit down with a financial planner or someone from your company and go over the pluses and minuses of a current plan offered. Number 2. Over-communicate with your insurance company. So for example, as I'm a patient, I would go to my insurance and I commonly use their chat feature because I like to have record of what we talked about, and it just worked better for me. I would double check if the provider I wanted was in network. I would ask what the costs associated with that provider, even though they're in network, would be, so a copay. I would ask about any other fees that I should know about. Communicating with your insurance just helps a lot with expectations of what you're going to pay. So here's a good example of this. My doctor is covered through my insurance. She's considered in network. But if she orders a lab result to be done in the same exact room she's in, that is considered out of network. So unfortunately, I learned this the hard way. I paid $300 for a lab draw in her office when I could have just driven down the street to a different lab and paid $25 for that exact same lab draw. So you live and learn. Something I really want to make sure I try to share with everyone I can is just over communicate with your insurance. The questions that you think you know the answer to and that seem like there should be an obvious answer, it's not always the case. So just double check, triple check what your fee is going to be for a service and ask them where you can get that the cheapest if expense is something important to you. Number 3. So cost is something that's really important to me and my husband. We try to keep our healthcare costs as low as possible, partly by staying healthy and partly by talking to our insurance. In a perfect world, my doctors would be able to go into my online profile and check and see all of my labs. But because I've had to go to some outside labs, that's not the case. So I've had to be really organized with my healthcare information. So I just keep a file just like this. I have my lab results all in a folder stacked from what's most recent. I also have business cards that doctors have given me so that I can find their number easily. And I also keep any paperwork that I get from appointments, such as after visit summaries or discharge paperwork, all in one place. And it just makes it that much easier to be organized and find what I need when I need it. Number 4, know your copayments and your deductible. There is nothing worse than getting a bill in the mail that you did not prepare for or that is much higher than you expected. Knowing your deductible is also really important for planning different services. For example, our deductible year end is in July. Most people assume that January 1st would be year end, but since ours is July 1st, we can plan a couple things around that. So my surgery was more money than we typically spend on just preventative healthcare. So some of the other things that we need, like dental work, it kind of makes sense to plan those after we've already met our deductible so that we can just kind of build that into things that our insurance covers. Not only is it just good to know what your copays and deductibles are, but obviously if you stay on a budget, this is a really important thing to know. Number 5, This one is really important to me and something that I've just been learning more about as I've had appointments after appointments in preparation of this thyroid surgery. Prepare for appointments by keeping a notebook just like this with notes and questions that you need to ask your doctor during your appointment. What's nice about a notebook is that you can keep all of your thoughts in one place so that you can jot down answers to those questions during an appointment and also refer to it for your questions. The other thing I think is a really nice bonus, if you can do it, is to have a second set of ears with you for appointments. During the coronavirus, everyone's been limiting the number of people that can come with you to an appointment. In my case, my husband was able to just be on speakerphone during one of my appointments, and that really helped. One, because I didn't have to kind of rehash the entire appointment afterwards, and secondly, it just helped me remember anything I had forgotten because there had been another set of ears there that could recall something I didn't, or maybe interpreted something a different way. This is really helpful for non-routine appointments, maybe an appointment for something you don't know very much about. Routine appointments, such as like your annual physical, those you might not necessarily need a second set of ears, but it's still helpful to have a notebook or something you can refer to with any questions you might have jotted down. Number 6, utilize the online system. This might be MyChart. Whatever online profile that's offered for you, I highly recommend using it. This is a great way to talk to your providers if you have a non-urgent question, a follow-up question, maybe you needed clarification on a medication that you're taking. I believe providers get 24 hours to respond to you, and I found that this is a great way just to continue relationship with providers. For example, I let my primary care physician know that I had just spoken to an endocrinologist and that I was planning on having surgery on June 22nd. And what was so nice about this was that I kind of just reminded her to review the note from my endocrinologist so that she knew what the plan of care was. And she just so happened to be in-house during the week of my surgery, so she was able to come visit me and say hello while I was inpatient. I don't know that that would have happened if I didn't tell my primary care physician via MyChart that I'd be in the hospital. I've had other non-urgent questions I've been able to ask over MyChart. You can send documents, you can send pictures. I ended up sending a video of my goiter when I had it to the endocrinologist since we needed to have a telehealth appointment on the phone. That way he was able to see my neck and what it looked like. Number 7. This one by far is the most important to me. I'm very passionate about it, and this is to advocate for yourself. Don't assume that anyone else will advocate for you. Yes, your nurses and your doctors, they all should have your best interest, but you must advocate for yourself. If you saw my video about being in the hospital during my thyroid surgery, you know that I am also a big advocate for pain management and asking for the things you need. So a good example of this is if you're in the hospital as a patient and you do have pain, talk with your nursing staff about what medications you have ordered, create a plan with them for how often you'll get them and what to do if that pain medication is not managing your pain well enough. Do this at your doctor's appointments by bringing your notebook with you with questions and make sure all those questions are answered before the appointment is over. Do this by talking to your insurance company and finding out the costs of your copays. Know the ins and outs of your health savings account if you have one, or flexible spending account. Advocate for yourself if you're an inpatient or an outpatient by asking for what you need and being prepared. And look on reputable sources if you do want to do your own research about your condition. My favorite is Up to Date. That's a great place to go if you do have some medical background, although there are options for patients that spell things out in a simple way or a detailed way. As a nurse, I thought that I was pretty aware of what to do as a patient, but being a patient myself for the last couple months, I have really just opened my eyes to the complexities of healthcare, things that you can't plan for, the intricacies of talking with insurance and getting bills that you were not prepared for, finding the lowest cost and most convenient place to get healthcare services. All of these things have just been a huge learning experience for me, and I really wanted to share that with you and pass it along. So I hope this was helpful. If you have any questions or comments, leave them below. You can also contact me on my webpage, www.happyartichoke.com, by clicking any of my social links or scrolling to the bottom of the browser and clicking Contact Me. I hope you have a great day. Thank you for visiting the Happy Artichoke.